Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. We're here at the DirectTrust conference, and our guests are Mike Green, who's Chief Information Security Officer at Availity, and Krisi Hutson, Senior Director of Solutions at Availity. Welcome.
Thank you.
It's great to be back with you, John. It's always good to chat.
Yeah, exactly. I loved our last interview that we did, Krisi, and Mike, glad to welcome you here. Before we dive into today's topic, Krisi, why don't you start us off? Tell us a little bit about yourself and Availity.
Sure. So I run the solutions department with Availity. I've been with the organization, been blessed to be there about 16 years. Prior to that, I was in the provider space, leading revenue cycle and compliance offices, and really have had a chance to take and be a provider advocate, both in the payer and provider world. I'm blessed to be with Availity, who is really the largest clearinghouse within the healthcare world today. We've been through a tremendous amount of customers, both on our provider and our payer side, helping to really ease the abrasion between providers and payers, exchanging both administrative and clinical transactions.
Awesome. Mike, how about yourself?
Sure. My name is Mike Green. I'm the Chief Information Security Officer at Availity. I've been there about 3.5 years. Prior to that, I was with Cigna, Express Scripts, and then spent about 10 years with Deloitte. I am passionate about cybersecurity, and more specifically, passionate about cybersecurity in the healthcare industry.
Yeah, absolutely. Well, I mean, I think security is top of mind for every healthcare organization today. I think that was epitomized by the Change Healthcare Cyberattack, which was big and had massive implications on a number of levels. You know, Availity played a big role in helping health systems kind of continue to perform these necessary electronic transactions during that. Krisi, maybe you could start us off. Talk to us about the experience of your company providing, services to these, and give us an overview of the Availity Lifeline response.
Sure, I'd be happy to. So it really was, we felt a shift in the ecosystem with the cybersecurity attack, and we were very blessed to be able to help the community as well as really all our partners within the industry. However, it wasn't something that was, I would say, unexpected because of the environment that's been going on. And it's one thing that at Availity we're blessed to have Mike as our CISO, really helping to put good policies and procedures that were in place to help us be able to stay strong and recover quickly. With our Lifeline project, as you alluded to, because there was such a shift in the ecosystem, really it was almost like someone turned off the faucet for a large amount of transactions that were flowing. And the reality is that at the end of that faucet is patients receiving care. It is payers being able to fund that care. It's providers being able to orchestrate. And so we put our Lifeline process in place. Lifeline was where we didn't really put any fees with it. We didn't put any contractual obligations except for very lightweight, data exchange agreements. And we helped to bring a tremendous amount. We went up by about 40% in volume in terms of what we were carrying in our transactions to be able to either redirect network traffic where maybe their current or their existing path was not in place, or actually move full provider health systems onto our network very quickly so that we could help remediate, bringing financial relief to those organizations. Because there were ways that Change was trying to help with the financial burden as well, but actually just being able to free up the ability to submit those transactions again. And we felt we had an obligation to the industry, and I'm very proud of what the organization did there, and we are continuing to help in many ways.
Yeah. And I just might add, this was something we had been thinking about as a company and planning for, and we'll probably talk about that a little bit later, but this is something we'd been thinking about and planning for quite a while, just kind of understanding what was happening in the industry. And I think because of that pre-planning, because of sort of thinking about the future, we were able to execute this in less than 48 hours.
Wow. Well, and I think that was maybe one of the big lessons from the Change, cyber attack, is that it's not enough to just mitigate the fact that you're going to be breached. In fact, many CISOs would say that. It's not a matter of if, but when are you going to be done? So then it begs the question, health systems need to consider how quickly you can recover from an attack. Talk to us about that, Mike. What measures should providers really consider to ensure this service continuity in the face of future disruptions, which I'm sure are going to come for every organization?
So you're absolutely correct. And I want to say up front, everyone should be planning to be breached. It's not a matter of if, but when, and it's about how you recover from it. So the first thing is, having a defense in depth program, right? So having a really good security program at the beginning. So that's plan A, keep the bad guys out. Plan B really has to be about resiliency and redundancy. It has to be about how are you going to recover, not just recover from a technology event, right? But recover from the financial event. How are you going to recover from the loss of confidence, the loss of trust in the industry? It's really about wargaming those things out, and not as just a tabletop one time, but making sure your entire organization thinks about this. How are you going to interact with your third parties? How are you going to interact with your suppliers? How are you going to interact with people downstream? Are they aware of what your resiliency model looks like? And not to dive too far into the technology, but you've got to think about things like, if you go to your backup data center, are you going to be able to connect to your third parties? Do they know how to send you data, right? So it's really about thinking about your position in the ecosystem, your position from a resiliency and recovery standpoint, and then beginning to communicate that out to a larger community.
Yeah, interesting. You mentioned this defense in depth approach. Talk to us more about how Availity is using that to be able to safeguard your electronic assets.
Sure. So defense in depth is a common security model, and what it really means is you rely on no single control, right? So if someone's trying to plant malware on a machine, you're not just relying on a control on the endpoint, but you're relying on monitoring at the network. You're relying on blocking from a email perspective. Like, you're leveraging defense in depth. So you've got multiple walls, multiple points in the path for the bad actor for a signal to get to your security team or others, right? So your operations team or just your users, for them to say something interesting is happening here. My password got changed. My machine's acting weird. So that gets back to the security team and they can address it.
Interesting.
I would love to say too, my advice to the provider community is really give your security team the space and the room they need. Because sometimes when you're running the business office or you're out there on the front lines of care, you can think, oh my gosh, what is this protocol we're going through? Why am I getting these crazy emails? Why do they want to make sure I click that phishing button, right? And it can feel burdensome and heavy. What I will tell you, it doesn't feel heavy when it's protecting you, right? When you can know that you have pieces and process in place. At Availity, for example, we would run through disaster recovery programs. And I would think, as I was executing on the business side, man, that's a significant investment, right? I could be advancing something today for a customer, but what I'm doing is I'm helping to protect that customer by really trusting our security protocol, giving them the space they need, and understanding that is a key. It sounds so silly, but I know I've sat in everybody's seat, right? They're thinking, man, this is enough. This is heavy. I'm telling you, not doing it is so much heavier.
So I'll just say this: security for Availity is a market differentiator. I would never say we're the best or we're, but for us, we take it very seriously. And my advice to the provider community would be to start thinking about security as a market differentiator, as something that is core to your business, just like your finances, just like your patient satisfaction. Think about security through the same lens.
Interesting. Yeah, I often say ignorance is bliss until it's not. And it's like that's kind of what you're saying, right? If you're ignorant to it and then you're breached, well, then you're going to really regret it. And we see that happening all over the place in healthcare. Mike, what would you suggest as some of maybe the key cybersecurity trends and threats in healthcare that organizations should be looking at?
So honestly, back to the disaster recovery piece, really thinking about your disaster recovery. With the recent breaches, so we talked a little bit about change, but as I look across the ecosystem, the number of people that are being breached, the number of provider and provider-associated organizations that are being breached, for me, in my position, is greater than I've seen over the last 3 years. It is really and truthfully about being able to recover and recover quickly, knowing that, with more people being breached, with more bad actors getting paid, it is bringing in more bad actors, right? This is a field, unfortunately, that is ripe for bad actors to earn a quick buck. And the more of them that are successful, the more it brings in, the more volume you have, the more it grows in this industry. So really and truthfully, being able to recover quickly, not having to rely on the bad actor to give you a recovery key. Things like, basic things like immutable backups, defense in depth, all of those things. And again, having an active recovery posture. And I'll give you an example. At Availity, we test our recovery posture every quarter. So we go to our secondary site, we bring all of our systems up. They're fully resilient, fully redundant. We bring all those systems up, everything except for swapping the IP address. And we're required to do that in 6 hours or less. So being able to have that kind of cadence is really important.
Yeah, and a real test of it. We just heard from Mickey Tripathy here at the DirectTrust conference. What do you think regulators like Mickey and others, in the government, regulators, legislators, et cetera, what should they do to help us, further respond and safeguard the industry from these large-scale attacks that are happening?
So I'll take that, and then if you want to add to it, yeah. So we've been working with the federal government. We've been talking quite a bit to congressmen and women about what we think, specifically in our space, for clearinghouses. So, frankly, I think there is a need for additional oversight. I think there's a need for additional regulations in our space, and I'll give some examples. So, requiring clearinghouses to meet something like NIST 800-171, requiring clearinghouses to begin to implement things like IL2 or Real ID. So if you've got your new driver's license that is really weird looking, requiring things like Real ID, requiring things like a SOC 2 with all 5 trust service criteria, and not just for some subunit of your business, but for the entire business, right? Really sort of recognizing that the risk isn't just that small space, it's your entire business, right? And being able to provide that sort of coverage for the clearinghouse space, we think is important going forward.
Yeah. Krisi, what would you add? I mean, you talk about, collaborating with the security personnel. I think that's such an important message. How can providers work more collaboratively with the security personnel to kind of further these safeguards in your current environment, but also as you evaluate other technology partners, what would you have done? What would you suggest to providers?
I think communication is number one, from your business office, your revenue cycle teams, your clinicians, back to your security personnel and your IT shop. So running real scenario conversations, having, very basic questions. Because Mike, I don't know what you do really. I know you keep us really well protected, and you've got us in a great place to really help the industry. I bet you don't exactly know what I do when I go out and I can help with software, right? So unless we talk to each other and Mike understands, what does my basic day need to look like? And, I can say, Mike, what happens if I don't have my email, right? What if I can't get into my email and there are these customers I need to connect with? What happens if I don't have a laptop? What happens if I lose a major portion of connectivity out of my network or a third-party vendor? By me really being transparent about what I need to both operate an MVP version of our business, that minimal viable, all the way to, how we would add things back to get back to optimal experience, that helps, because you want to take an active role, because you don't want these guys making the decisions for you, right? Like you don't, and
Agreed.
they need to know, right? And he doesn't want to make those decisions, right? But you've got to be willing to come to the table. You've got to ask good questions. You've got to, I don't really need to know what an air gap computer is, but I need to tell Mike, I'd like to have one that if everything goes bad, can I get a computer turned on pretty quickly and get back in work and be able to, get appointments scheduled for patients. Okay. So it's us getting to those levels of conversation of what is basic operating, and then be involved. From the legislative perspective, I think it's actually asking good questions of your vendors, the vendors that have the biggest voice. I will tell you, our personal experience as Availity, we were always very involved with regulatory committees in the healthcare space, but we weren't super vocal, right? Because we were feeding out information through our customers and we're supportive. We feel like everybody has an obligation now. People actually know what a healthcare clearinghouse is now, because unfortunately, when it stops performing optimally at such a large scale, it can mean real things to the people of our nation, right? Prescriptions can't get filled.
Yep.
People can't see the doctor. So speak up, understand what your position is. We would be happy to share some information with you guys of where Availity is taking a position as far as where we believe the legislative pieces should land. We could give you some access to materials for that for your viewers, and conversations. Have conversations, talk, and create a good partnership between your business operational teams and your security team.
That's great. Yeah, and we talked about Change Healthcare, but CrowdStrike was another example
Absolutely.
where the desktops were gone. And they didn't have it. So you're right. It has to be this comprehensive approach. And I think it's amazing that Availity does a full recovery, which many organizations want to do but haven't done.
Yeah.
I love that. Well, Mike, Krisi, this was a lot of fun. Really interesting perspective on a really important topic. So I appreciate you taking time to talk with us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks.
Thank you.
Thank you.